Now let us look into the pharmacodynamics of sulfa drugs. Okay, here we discuss the mechanism of action. Often mechanism of action is abbreviated as MOA. So to understand the mechanism of action of sulfa drugs, we need to look at the folic acid pathway and see how it differs in the bacteria and in humans. So the first step in the pathway, the folic acid pathway, is what happens to para-aminobenzoic acid, okay, PABA. So this is the structure of PABA. What is PABA again? Para-aminobenzoic acid. Okay, so this is the starting step in the folic acid pathway as far as bacteria is concerned. So PABA in the bacteria is acted upon by an enzyme called dihydropteroate synthase. Okay, so this is dihydropteroate synthase. So what does this do? Synthase meaning it synthesizes dihydropteroate, and when it does that to PABA, what happens is it produces what is called dihydrofolic acid. Okay, dihydrofolic acid. Now, dihydrofolic acid is then acted upon by another enzyme, and this enzyme is dihydrofolate reductase. Dihydrofolate reductase into tetrahydrofolic acid. Tetrahydrofolic acid. And this tetrahydrofolic acid or folic acid is used to synthesize purines, pyrimidines, amino acids, etc. Okay, so these are called purines, pyrimidines, and amino acids. They are metabolites. Okay. So from this we understand that folic acid is essential for synthesizing purines, pyrimidines, and amino acids. Now purines and pyrimidines, we all know, are the building block of nucleic acids, and amino acids are the building block of proteins. So for a bacteria, if suppose this is a bacteria and the bacteria needs to divide into two, then what does it need? It needs to synthesize nucleic acids. It needs to synthesize proteins. Okay? Now, if we interfere with the folic acid pathway, then obviously we're going to interfere with the synthesis of purines, pyrimidines, and amino acids, because of which the bacteria would not be able to divide. So that's the idea here. That's what these the sulfa drugs do. Okay. But think about it. If this pathway is the same in humans, when we give sulfur drugs, it should also interfere with our synthesis of purines, pyrimidines, and amino acids. So then it wouldn't be a good drug, would it? Because when we say an antibiotic drug against bacteria, it should kill only that bacteria. We don't want it to kill our own cells. So then that's the concept of selective toxicity. So it should be selective to bacteria, but it should spare the human cell. So let's see how it is spared in this human cell. For that, we need to understand what's the folic acid pathway in humans. So in humans, by evolution, we have the ability to take preformed folic acid. Okay, folic acid. So we take preformed folic acid. So where do we get this folic acid? We get it from our diet. Okay, so we have got transporters to transport folic acid. So we have got specific transporters. Let's say this is a cell membrane, and let's say this is a transporter for folic acid. So let's say this is the cell membrane, and we have we have a transporter so that's a transporter for folic acid, and this transporter enables our folic acid, enables folic acid to be taken into the cell. Okay, so folic acid gets transported into the cell, and that folic acid is acted upon by this enzyme dihydrofolate reductase to form dihydrofolic acid. And this dihydrofolic acid is subsequently acted upon by dihydrofolate reductase to form tetrahydrofolic acid. And then this steps is as in bacteria. Okay, but what's different is we don't have the synthetic pathway. Okay, we don't have para-aminobenzoic acid being converted to dihydrofolic acid. So we directly take in folic acid. Okay, from our diet. Okay, so this is the point of difference between human beings and bacteria. Okay, so bacteria they synthesize the folic acid inside their cell by a process that we call de novo synthesis. Okay, so synthesis from first principles. So de novo synthesis is in bacteria, and we directly take in preformed folic acid. So which is the enzyme that we lack? We lack dihydropteroate synthase. Okay. So human beings lack dihydropteroate synthase. So now the idea is, if we can block dihydropteroate synthase, then what can happen? The bacteria will not be able to produce folic acid at all. Okay. But we wouldn't interfere with the folic acid pathway in humans because we don't have this enzyme. Okay. So now if we block this enzyme, it will be selectively toxic to bacteria, but it would spare human cells. And that is exactly what sulfur drugs do. Okay, so sulfur drugs, let's write it down here. So what's the mechanism of sulfur drugs? Sulfur drugs inhibit sulfur drugs inhibit. What do they inhibit? Dihydropteroid synthase. Okay, so what's the mechanism of action of sulfur drugs? Right. So they sulfur drugs inhibit dihydropteroid synthase. So we also answer another question. Why don't sulfur drugs interfere with the folic acid metabolism in humans? Yes, because we lack the enzyme dihydropteroid synthase, and human cells we directly take in folic acid. We do not synthesize folic acid from para-amino benzoic acid. Okay. So that is selective toxicity. So what is our sulfur drug doing here? It is interfering with the metabolism of para-amino benzoic acid. Okay. So that is why it is called an anti-metabolite. Okay. So sulfur drugs are anti-metabolites. Okay. So now we can define what are anti-metabolites. So what are anti-metabolites? Anti-metabolites are analogs, structural analogs. Okay, so let's draw the structure of sulfonamides, and so we can understand what's going on here. Why do we say it's a structural analog? Okay, so this is sulfanilamide, one of the prototype drugs. Now if you see, if you compare these two structures, you see that they are similar. Okay, they are similar, but they are different only at this having this moiety here. Okay, so they are structurally similar, so that's why we say they are analogs. Okay, so antimetabolites. What are antimetabolites? They are analogs of naturally occurring compounds that interfere with their metabolism when we say metabolism, we mean with their formation or utilization. Okay, formation or utilization. Thus inhibiting essential metabolic pathways. Okay, so let's see if this definition fits with the mechanism of action with sulfur drugs. Okay, so what did we say? Antimetabolites are analogs of naturally occurring compounds. Okay, which is the naturally occurring compound here? It is PABA. Okay, so what's it doing? It is interfering with the formation or utilization. Okay, so what's it doing? It's a competitive inhibitor. Okay, it is a competitive inhibitor of PABA. Okay, so sulfur drugs are competitive inhibitors of PABA. Okay, so what do we mean by competitive inhibitors? It means if we give, if this bacteria, initially it is given sulfur drug, and if you give increased amounts of PABA, then the effect of sulfur drug will decrease. Okay, so that is why it's called a competitive inhibitor. Okay, all right. We have made it clear that sulfur drugs interfere with the metabolism of PABA, and when you do that, what happens? We interfere with the metabolic pathway of purines, pyrimidines, and amino acids. Okay, so now we have explained the mechanism of action of sulfa drugs. Okay, let's look at what's happening here. So there is this bacteria, okay, that normally undergoes bacterial reproduction to form two bacteria. Okay. Now, we said that this process requires purines, pyrimidines, and amino acids. And amino acids which are essential to form proteins, because this bacteria needs some enzymes to undergo division. And now we have said that we have interfered with the folic acid pathway. So if you interfere with the folic acid pathway, what's going to happen? The bacteria will not be able to divide. Okay, it won't be able to divide. So what does sulfa drugs do? Sulfa drugs stop bacterial division. Okay, so they don't kill the bacteria, but they inhibit the ability of the bacteria to undergo bacterial fission, bacterial division. Okay, so they stop bacterial division. So technically we say that sulfa drugs are bacteriostatic. Okay, so what does bacteriostatic mean? It's not able to divide. Okay, so in that aspect, it is kind of static. Okay, it's not it's not dynamic in the sense that it does not divide into two. So these drugs are bacteriostatic agents. And so we have studied that antibiotics can be bacteriostatic or they can be bactericidal. Bactericidal means they kill the bacteria. Okay, but sulfa drugs are bacteriostatic. So what's the mechanism then? Now we are stopping the bacteria from dividing, but our aim is to eliminate the bacteria from the body. So how does the body eliminate the bacteria when we give a bacteriostatic drug? Okay, so what the bacteriostatic drug does is it permits or it allows the normal phagocytic and the immune pathway to clear the infection, to clear the remaining bacteria. Okay, so that is the use of a bacteriostatic drug. So what does it do? It does not allow the bacteria to multiply, and if it does not allow the bacteria to multiply, the number of bacteria that are present will be removed by the normal phagocytic and the immune pathway in our body. Okay, so that also brings us to a point. Suppose we don't have a functioning immune system. Okay, or if our immune system is compromised somehow, like if we are infected by the HIV virus. Okay, so in such cases, what happens? We don't have a functioning immune pathway. So if we don't have immune functioning pathway, do you think bacteriostatic drug would be helpful to us? No. Okay, so bacteriostatic drugs are usually administered only if the immune pathway is functional. We don't give a bacteriostatic drug if the immune pathway is compromised, either due to infections like HIV or by drugs immunosuppressant drugs that, for example, in a transplant patient. Okay, a transplant patient would have immunosuppressants. So what would happen if the immune pathway is already suppressed? So we don't give a bacteriostatic drug. Instead, we would give a bactericidal drug. Okay. So sulfa drugs are bacteriostatic. Okay. All right. Sulfonamides have a broad spectrum of activity. Okay. So sulfa drugs are broad spectrum. So what do we mean by broad spectrum? That it's effective against both gram-positive and gram-negative bacteria. Okay. Yeah. So that's another point that we need to remember about sulfa drugs. So sulfa drugs are broad spectrum, bacteriostatic, antimetabolites. Okay. Right. So sulfa drugs we discussed are given in combination with other drugs, and the most famous example is the combination of sulfamethoxazole with trimethoprim. Okay. So let's discuss some points about this combination. So the first question that we address is, why is this combination given? Why? Why specifically sulfamethoxazole? So we have studied there are lots of sulfa drugs. So why this drug is chosen to combine with trimethoprim? The reason is that sulfamethoxazole has similar pharmacokinetic properties to trimethoprim. Okay, so that's the reason why it was chosen. Okay. So the second question that we need to look at is at what dose is it combined? Okay. So the dose at which it is combined is, let's say, sulfamethoxazole to trimethoprim. Okay. So the dose that is administered is 5:1. Okay. So the okay, it's given at a ratio of 5:1. So the usual dose that is clinically used is to administer 2 tablets. So especially in patients greater than 12 years, okay, 2 tablets twice daily. Okay, so each tablet, so let's draw a tablet here, and each tablet would have 400 milligram of sulfamethoxazole to 80 milligram of trimethoprim. Okay, so this is how this is the regimen basically. Okay. So if we look at this ratio, that would be about, so let's say 400 by 80 is 5. So 5:1. Okay. So this is the regimen at which it is given. Okay, so now the question is, why this regimen? Okay. Why 5:1? The reason is, when studies were conducted, it was observed that if this dose was given per oral, then in the blood, the concentration that was obtained was 20:1. Okay, so if we take this tablet orally, then we will attain a concentration of 20:1. What is the significance of 20:1? It has got maximum synergistic antibacterial activity. Okay, so this was the reason why so this is the reason why 5:1 is chosen. Okay, so now we know why 5:1 ratio is chosen. Okay, because once it reaches the blood, we get it in a concentration of 20:1. So now next question is, why 20:1? Okay, why we get 20:1? The reason is that trimethoprim is more lipid soluble. Okay, so as a result, it goes into tissues and the free drug reduces. Okay, so that's the reason why we get 20:1. Okay, so now the question is, in some markets, we get drugs like Cotrimoxazole Double Strength. Okay, so what does that mean? Okay, so so what is double strength? So we said, what is the dose? 400:80 is the dose in one tablet, and the regimen is 2 tablets 2 times a day. Okay, so the idea is, why can't one administer 800:160? So if you are able to administer 800:160, then you need to give only 1 tablet 2 times a day. Okay, so this is double strength. Okay, so this gives us the logic behind why in some markets double strength tablets are available. Okay, okay. So now we come to this overarching question: why this combination is preferred? What is the rationale of the combination? Okay, so why is this combination given? What's the logic behind the combination? So the rationale is, there are 3 reasons. One is that there is synergy. Okay, we'll visit this point again. The second reason is that the combination was found in studies to be bactericidal. Okay, this is an important point. We'll be visiting this point again. And the third is that it is supposed to prevents development or emergence of resistance to the individual components. Okay, so which are the components here we are talking about? It is, yes, sulfamethoxazole and trimethoprim. Okay, so the resistance of the bacteria to sulfamethoxazole and trimethoprim would be prevented. Okay, so that's the clinical rationale of the combination. So let's see what's the mechanism. Okay, so now we are going to look at what is the mechanism of the combination. Okay, for which we need to look at this diagram again. Okay, so we said that sulfur drugs inhibit dihydropteroate synthase. Now, trimethoprim inhibits dihydrofolate reductase. Okay, so dihydrofolate reductase is inhibited by which drug? Trimethoprim. Inhibits dihydrofolate reductase. Okay. So yeah, so that is the mechanism of trimethoprim. Now, if you give it in combination, it becomes bactericidal. So let's write it down here. Combination or cotrimoxazole. What is that? It is a combination of sulfamethoxazole and trimethoprim in a ratio of 5:1. Okay, so that is cotrimoxazole, and this combination is bactericidal. It kills the bacteria. Okay, so that's the idea. Okay, but what we need to remember here is trimethoprim acts on dihydrofolate reductase, and this dihydrofolate reductase is present in human beings. Okay, so the question is trimethoprim having selective toxicity? Okay, so the reason we can understand if we look at the therapeutic index. So the therapeutic index with respect to sulfonamide would be about 3:1. I mean, it's having about 3:1. Okay, so say 3:1. That means trimethoprim has about 3 times selectivity to bacterial dihydrofolate reductase. Okay, so it has got 3 times more selectivity towards bacterial dihydrofolate reductase, and therefore it can be thought of having selective toxicity. Okay, so that's another point that we need to remember. Okay, but does it can it affect humans? Yes. Okay, so trimethoprim can affect human cells because we have got this enzyme dihydrofolate reductase, but it is more selective to bacteria. Okay, so if we have infection and we give trimethoprim, then it will inhibit the um, the bacterial fission of the bacteria. It will inhibit the fission, okay, bacterial fission, okay, more than it affects our cells. So it's selectively toxic, okay. So, but the combination to remember is bactericidal, okay. It kills the bacteria. So now what could be the logic? Why does it kill? So you think about this, there is this bacteria, and to grow and maintain its viability, it needs to continuously try to produce enzymes, for it to undergo its normal metabolism. Okay, it needs to make housekeeping proteins. It needs to do that on a continual basis. Now, even that normal metabolism would be inhibited if this combination is given. Okay, and therefore the bacterial cell will not be viable if this combination is given. Okay, so that's why it's bactericidal, right?